Cyclosporine Modified is a medication used to prevent rejection of transplanted organs such as the liver, kidney, or heart. It is often taken with other medications to help the new organ function properly. Additionally, this medication is used to treat severe cases of rheumatoid arthritis and plaque psoriasis, where the body's immune system attacks healthy tissues. Cyclosporine Modified belongs to a class of drugs called immunosuppressants, which work by weakening the immune system. This helps the body accept the new organ as its own, and prevents further damage to the joints in the case of rheumatoid arthritis, or the skin in the case of psoriasis. The dosage of Cyclosporine Modified varies depending on the individual and their specific condition. It is important to follow the instructions given by your doctor or pharmacist. It is usually taken once or twice a day, with or without food. It is important to take it at the same time each day to maintain a consistent level of medication in the body. Be sure to take the medication exactly as prescribed to get the most benefit from it. When taking Cyclosporine Modified, it's important to follow your doctor's instructions and take it twice daily. You can take it with or without food, but it's important to choose one way and stick with it for each dose. The dosage of Cyclosporine Modified is based on your weight, medical condition, lab tests, and how you respond to the treatment. While using this medication, it's best to avoid eating grapefruit or drinking grapefruit juice, as it can increase the chance of side effects. Be sure to ask your doctor or pharmacist for more details. To get the most benefit from Cyclosporine Modified, use it regularly and try to take it at the same times each day. It may take up to 4 months before you experience the full benefit of this drug for the treatment of rheumatoid arthritis and psoriasis. If your condition doesn't improve within 4 to 8 weeks for arthritis or 2 to 4 weeks for psoriasis, or if it gets worse, be sure to inform your doctor. Some common side effects of Cyclosporine Modified include shaking, headache, dizziness, unusual growth of body hair, nausea/vomiting, diarrhea, stomach upset, or flushing. If any of these effects persist or worsen, notify your doctor or pharmacist. You may also experience unusual growth and swelling of the gums. To reduce this problem, make sure to brush your teeth and floss daily, and see your dentist regularly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefit to you outweighs the risk of side effects. Many people using this medication do not experience serious side effects. Cyclosporine Modified may also raise your blood pressure. Be sure to regularly check your blood pressure and inform your doctor if the results are high. Your doctor may need to prescribe medication to help control your blood pressure. If you experience any serious side effects such as signs of kidney problems, signs of liver disease, easy bruising/bleeding, unusual tiredness, muscle weakness/spasms, slow/irregular heartbeat, numb/tingling skin, severe leg pain, mental/mood changes, vision changes, problems with speech, clumsiness, loss of coordination, weakness on one side of the body, seizures, or chest pain, seek medical help immediately. Although rare, a serious allergic reaction to this drug is possible. Seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of potential side effects. If you experience any other effects not listed, contact your doctor or pharmacist. Cyclosporine Modified is a medication that reduces your body's ability to fight infections, which can make you more susceptible to getting serious infections or making existing infections worse. It may also increase your risk of certain types of cancer, such as skin cancer and lymphoma. If you experience symptoms of infection or cancer, such as a persistent sore throat, fever, chills, cough, burning or frequent urination, unusual skin changes, changes in moles, unexplained weight loss, swollen lymph glands, lumps, or night sweats, it is important to notify your doctor right away. This medication can also lead to high blood pressure and kidney problems, especially with higher doses and longer treatment. Your doctor will monitor your blood pressure and kidney function while you are taking this medication. It is important to note that patients with psoriasis who have undergone certain previous treatments may have an increased risk of developing skin cancer. It is essential to discuss the risks and benefits of taking this medication with your doctor. Additionally, different brands of cyclosporine may deliver different amounts of the medication, so it is important not to switch brands without your doctor's permission and guidance. Before taking cyclosporine, it's important to talk to your doctor or pharmacist about any allergies you may have, as this medication may contain ingredients that can cause allergic reactions. It's also crucial to discuss your medical history, especially if you have kidney or liver disease, high blood pressure, cancer, or any mineral imbalances. Cyclosporine may cause dizziness, so it's important to avoid alcohol or marijuana, which can make this effect worse. You should also be cautious if you are pregnant, breastfeeding, or have liver disease, as this medication may contain alcohol. It's important to be aware that cyclosporine can increase your risk of getting infections or make existing infections worse. It's important to avoid contact with people who have infections that can easily spread, and to inform your healthcare professional before receiving any vaccinations. This medication can also increase your risk of developing skin cancer, so it's important to limit your time in the sun and avoid tanning booths and sun lamps. Your doctor may advise you to avoid phototherapy while using this product. Cyclosporine may also increase your potassium levels, so it's important to consult your doctor before using potassium supplements or salt substitutes. Before undergoing any surgery, it's important to inform your doctor or dentist about all the medications you are taking, including prescription drugs, non-prescription drugs, and herbal products. For older adults, there may be a greater risk of kidney problems or high blood pressure while using this drug. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of using this medication with your doctor, as it may harm an unborn baby or pass into breast milk. When taking Cyclosporine Modified, it's important to be aware of potential drug interactions. These interactions can change how your medications work and increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Cyclosporine Modified include coal tar, orlistat, other drugs that weaken the immune system or increase the risk of infection, drugs that may increase potassium levels, and tacrolimus. It's also important to note that other medications can affect the removal of cyclosporine from your body, which may affect how it works. Examples of these medications include bosentan, mifepristone, St. John's wort, ritonavir, and others. Additionally, cyclosporine can slow down the removal of other medications from your body, which may affect how they work. Examples of affected drugs include aliskiren, dabigatran, dronedarone, certain statins, and voxeloprevir. Remember to consult with your doctor or pharmacist about any potential interactions with Cyclosporine Modified. If someone has taken too much Cyclosporine Modified and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. Remember, do not share this medication with others. While taking Cyclosporine Modified, it's important to have regular lab and medical tests to monitor your kidney/liver function, blood pressure, blood mineral levels, cyclosporine blood levels, complete blood count, uric acid levels, lipid levels, and skin exams. Make sure to keep all your medical and lab appointments, and consult your doctor for more details. If you have had an organ transplant, it is recommended that you attend a transplant education class or support group. It's important to learn the symptoms of organ rejection, such as feeling ill, fever, pain around the transplanted organ, and signs of a failing transplanted organ. For example, a decrease in the amount of urine with a kidney transplant, yellowing of the skin/eyes with a liver transplant, or shortness of breath/inability to exercise with a heart transplant. If you experience any of these symptoms, seek medical help right away. If you forget to take a dose of Cyclosporine Modified, take it as soon as you remember. If it's close to the time of your next dose, just skip the missed one. Take the next dose at your regular time and do not take double to catch up. When storing Cyclosporine Modified, make sure to keep it in the original blister pack at room temperature, away from heat and moisture. Do not store it in the bathroom, and remember to keep all medications away from children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.